We've been receiving a lot of emails at work in regards to so many different things, preparing and planning for this pandemic. And one of the emails was from our system, and it was describing some things that people in Washington in our system are doing to prepare better, to plan ahead as supplies are running critically low. They showed a video of some staff, nurses, making face shields. And it looked like they were just in, like your classic conference room. And it struck me because I thought, gosh, are we getting to that? Is it really? I was a little bit blown away. And I have a brother and a sister. My sister lives out of state in Texas, and my brother's local. And they've just been asking me a lot of questions about, how's it going nursing wise? What's this looking like at the hospital? And, are you guys okay? And I just had forwarded them the video, just like, can you believe that, here it is 2020 and we might be making face shields? Like, is this even real? And within an hour, they both called me and said, hey, we could make face shields. And I'm like, sure, we can make face shields. But, currently, thankfully for all three of us, we're still working. They both have jobs and businesses, and I'm clearly needed at the hospital. So I was like, now, when are we going to do that? And then within 2 hours, my brother calls like, I've got some supplies. I've called some friends. I've got some money.
I reached out, kind of grabbed my Rolodex and reached out to Mel Trudell from Custom Comfort Mattress and Louis Valentine from A1 Canvas in Upland, guys I knew that were manufacturers and had these type of parts that were on the list that Jill supplied. Got them involved. A lot of businesses are closed because of this pandemic. And, with those two guys just making calls, just a grassroots effort to round up the materials.
My sister calls from Texas and says, we own a company that's, tech-based. I can make a website. How about this? How about protectourproviders.org? And I think by noon, still trying to do my regular job, I was a bit overwhelmed. I looked at my husband and I said, I don't know, did we just blow something up here? Can I handle all this? And he kind of looked at me. He's like, you, your brother, your sister, the rest of our family, of course we can do it. We can at least start it. It's a grassroots thing. Let's get the ball rolling and see where it goes. So by 4:00 that day, I was rounding up banquet tables for an empty office space that my family owns in Mission Viejo.
My mom and dad and I have a building here in Mission Viejo that just happened to be vacant. The tenant moved out the middle of January. So we made an office building into a manufacturing center in less than 24 hours and started producing product. I've done a similar thing to this before for funding for a guy that had cancer. So I reached basically back out through that same Rolodex and my contacts, kind of told them what we were doing, sent a few pictures, and just leaned on them to get the first, 10 grand. I think we've raised pretty close to $10,000 now to start, to get it kicked off, put it on people's charge accounts and my credit card, and just made it happen.
They kind of had the supply end going. My brother had some funds coming in. My sister had funds coming in, and just basically the call going out via the website and social media, which she's talented with. And then I had the nursing end really focusing in, like, how are we going to make this safe? We've got to keep people separated in the space. I've got to have tables cleaned correctly. I mean, we had the office space that was cleaned because it was previously used as a lab. So we re-cleaned that. We cleaned down our tables. I got up a system kind of in my mind of, let's check temperatures, let's make sure we're hand washing at certain intervals, let's be using hand sanitizer, let's make sure we have, gloves on hand.
We put a call out for volunteers and reaching out to friends and family and their friends and family, to everybody we could get that was willing, able bodies to, help fight through this.
Great as it was, I had a lot of elderly wanting to help, and I love them dearly, but I said, you've got to stay home. So what I wanted them to do to help us was make calls for maybe donations, make calls for people that maybe had connections with more supplies. So it really ended up just being this crazy spider web by, 6:00 Friday evening. It was just all kind of hands on deck and moving along. And by Saturday morning when we got here, we had a decent amount of supplies. There was some trial and error. We made a couple and that's not quite right. And we were given ranges of what we could use. We always, made it within the range, but had to, just little tweaks here and there. So our first batch was picked up yesterday afternoon by our chief philanthropy officer, and he brought them back to the hospital. He had one of our infectious disease nurses kind of examine them, see how, the product was going to be used, functionality of it. Had a couple tweaks we needed to make, which we started making by the afternoon. Today's tweaks are pretty much fine-tuned now, and we have a good crew on today, still checking temperatures. But I think by the end of the weekend, we'll be really close to 2,000 face shields, which some of them are already in use at the hospital. First of all, I'm a nurse, so I want to take care of people. I want to take care of my community. My sister, my brother, my parents, and I didn't really realize that my brother and sister had that same tug on their heartstrings. So it makes me feel good that they support my profession and that they just want to help their community.
My sense of accomplishment for this is just doing something, right? We can't just stand around and let this thing, I'm gonna get emotional for that part, let this thing beat us. We're gonna do everything that we can. I can't do anything medically, but I have maybe a little special talent in putting things together, so that's what I'll do.
And I'm so proud of, not just my brother and my sister, but, my mom and dad for rallying, sending lunches, sending food. All the kids that are living locally or back from college are, volunteering here in the warehouse. The ones that are remote still in Texas or wherever are helping with social media, sending, just words of encouragement, text messages, because, that age, they're tech savvy. So there isn't anybody in our family that didn't at least put a finger on something to at least say, we want to help. It touches you on so many levels that I don't think any of us ever really thought it would even come to something like that. And unfortunately, but fortunately, our younger generation is realizing that we all have to be here for each other. The sense of community is important. Helping your family means a lot, and helping your bigger family, which is your neighbors, your friends, your caregivers, everybody, is really what it's all about.